Welcome friends, today we have a very special episode of Western Doctor meets Ayurvedic Doctor. Today we won't talk about a specific disease, but we'll discuss Panchakarma, the famous Ayurvedic detox and regeneration treatment modality with my guest, Ayurvedic Doctor, Dr. Bhadran CK. Now, to introduce my guest, Dr. Bhadran is an Ayurvedic doctor with 12 years of experience and is currently overseeing clients here at the Arya Ayurvedic and Panchakarma clinic in southern part of Kerala. He has more than 10 years of experience in clinical Panchakarma, which is very relevant, especially for today's topic, dealing especially with patients from Europe. He specializes in obesity and other lifestyle disorders, skin diseases, particularly psoriasis and eczema, joint diseases like rheumatoid and gouty arthritis, degenerative diseases like osteoarthritis, geriatric diseases like Parkinson's disorder or insomnia, and lastly also has abundant experience in mood disorders and depression. So Dr. Bhadran, thank you again for joining me and very much looking forward to learning more about Panchakarma from you. Now, to just give you a little bit of a insight into Panchakarma from my end. So Panchakarma itself is a special kind of detox that is done in 3 phases. First is the preparatory phase, where the body is being prepared to release the toxins. The tissues are being prepared to release the toxins and to open the channels. This is then followed by the detox phase, made of 5 specific actions or karmas. This is where the name Panchakarma, the 5 actions, is coming from. And these actions are then done to create a detox in specific organ systems, in specific parts of the body. This is then followed by the rejuvenation or regeneration phase. So it is a detox, but it is not just a detox. It is actually a 3-phase protocol that involves both detox and rejuvenation. And it benefits both healthy as well as those with health issues, as it is always individualized. So there is a general frame of Panchakarma, but that frame is always adapted both for the person based on its constitution as well as for any health issues they might have. So this much I wanted to say about Panchakarma from my end. And now I would like to give the word to Dr. Bhadran and maybe just hear from you, what is Panchakarma?
Basically, especially for Westerners, Panchakarma means there is a massage. Common man, massage, oh I get massage, different kind of massage. Actually, Panchakarma, it's as you mentioned in your introduction, Panchakarma is detoxification procedures explained in Ayurveda. There are 5 types of karma, 5 types of therapies. It's called Vamana, Virejana, Vasti, Rektamoshana and Nasya or Shiro Virejana. Vamana means making the person vomiting in simple words, and Virejana means making the person purgation, like go to toilet, and Rektamoshana is bloodletting, getting the vitiated blood from the particular part of it, and Vasti is enema, medicated enema, giving the, and Shiro Virejana or Nasya, it is a nasal drops, putting nasal drops of powder or something just to cleanse that nose and little part of the body. So these 5 therapy called as Panchakarma, and it's pre-operative. There is a pre-operative stage, operative stage and post-operative stage. Like operation, surgery, we say pre-operative, operative and post-operative. The same also operative stage and post-operative stage. This pre-operative stage we have called Rukshana, Vasrukshana, Snehana and Svedana. Pre-operative. And operative stage we do either Vamana, Virejana or any one of this. And post-operative stage it is called a Samsarjana Karma. Means once the main action is done, our Agni will be very low. So just to improve the Agni and getting the balance of the doshas, we have to follow some diet and some activities. That is called Samsarjana Karma. So these are the important terms in Panchakarma. And what is the importance of Panchakarma? What is the need of Panchakarma? Panchakarma is needed not only for the deceased person and also for the healthy person. Like Swasthasya Swasthya Rakshanam is Ayurveda one motto. So to prevent the health of a healthy person, in specific season you have to follow some specific Panchakarma therapy to get to live healthy. And in case of diseases, if you have any dosha dushya samurchana, and if you have any samprapti, any disease, you have to follow any of these panchakarma according to the doctor's idea and which dosha is identified.
This is this is recommended, and I'll come back to this also later, but this is recommended as a preventative procedure also because in Ayurveda we know that disease process starts at the energy level already, and then if you have some constipation or acidity or gurgling or something is wrong, something is just not healthy, something is imbalanced, right, diseased, out of ease, then it's already a disease process happening, right? So Panchakarma then addresses.
Yes, I'll tell you, in Ayurveda, how the manifestation of a disease happen. It's in 6 stages. It's called Shat Kriya Kala. Kriya Kala, you might know that. Sanjaya, Prakopa, Prasara, Sthana Samshraya, Vekta and Bheda. Sanjaya means just accumulating the dosha, because dosha have to be there in natural site and do its action. But due to some external factor or because of your misbehavior or diet, improper diet or any climate change, whatever reason, it from the Vada sthana, if Vada is getting started little up, like started from this start, it's called a Sanjaya. So it's Acharya Sushruta say, if Sanchayo Abahrudo Dosha Labande no Uttarogati, means if one person or the doctor identified that, oh, this person Vada is getting up, so is getting Sanjaya state, then he should give some treatment like Panchakarma or any Shamana, then immediately it can down, it won't make any further stage. Next is Pragoba. Sanjaya, Pragoba means it's just started from this side, it started like Sanjaya. Pragoba means it's forming little higher, little more.
So first it's accumulating and then it's already like rising.
Upping, And Prasara means you just imagine that you are in a vessel, you put milk and just boiling it. So
and then it flows out.
Yeah, when it is heating, it starts bubbling. It's called Sanjaya.
So this is then this process where first you might feel a bit of tension somewhere. This would be
in the first day you feel some. I feel some uncomfortable. That is actually in Pragopa stage, because Sanjaya stage you don't understand anything. Because Pragopa stage only Purva Rupa and all start. Sthana Samshara, from the dosha from one place to another place, it start moving, then only it shows the predominant symptoms. That's why I am going to say Sanjaya, the milk, you put a vessel milk and boiling. That boiling starting is Sanjaya. Pragopa means it's coming up, Pragopa. Prasara means it's overflowing from that container. And Sthana Samshara, it's coming down and it is going to some other places, wherever their hole is there, in the nearby place it will go and lodge that milk there. It's what Sthana Samshara. And Vekta means you can clear that, oh, it is there, milk is there, wherever it is. And Bheda means it's final stage.
It's causing destruction.
You cannot, in Sthana Samshara you see the predominant symptoms, like, and Vektavastha. Prasaravastha you can see the predominant symptoms, and Sthana Samshara you can see the symptoms. And Vektavastha you will see all the complications, everything. Bheda Avastha is very difficult, like it's in chronic condition, because you see that you have a problem. Example, like you have a swelling in the knee joint. You saw it 3 months gone, 4 months, you didn't treat anything. Then 6 months later also it started with redness. Oh, okay, you didn't care, you walked without any, maybe you took some wrong medicine. Then finally it started depleting your joint, and you are going to destruct all the joints. That is called Bheda Avastha. So the intelligent physician should understand which sthana he is there. If it is in Pragopa Prasaravastha, then he can completely reverse back the situation. And in a person also, Swastha person also, if you feel that I put on little more weight, actually my weight is not like that, but I put on little weight, and that's why I feel some giddiness, I feel very lethargy, so I should do some exercise. That is a treatment. Then it's already dosha is coming now. Insight is coming now. That is a good thing.
So that's why Panchakarma is preventative, because you catch it in the first 2 or 3 stages and you get it out.
Ayurveda, according to Ayurveda, you know what is health. healthy persons, samadosha, samagnischa, samadhadu malakriyaha, prasanna atma indriya mana swastha ityabhidiyate. Samadosha, vada pitta kapha should be in balance. Samagni, digestion power should be good, and dhatu agni, the further digestion also should be good. Mala means your sweat, stools and urine should be normal. Mala and prasanna atma indriya. Prasanna means happiness in the atma, soul, indriya, sensory organ, and mana, mental. See, how many of us are healthy now? No one. Because prasanna atma indriya mana no one have. No one means rarely. Some we can count. He may be because some thought process or mana will be there, or sometimes feeling some eye problem, that sensory problem, some ear problem, or agni. So
to be completely blissful in your own being, right?
Yes. So that's why I told, I used to tell to my clients, patients every time, it is very easy to live unhealthy life. Very easy. You don't know to do anything.
Yeah.
Just give it whatever you like, eat, do exercise. But very tough to live a healthy life. Very challenging life. You should avoid some food. You should be active always. You should be
some exercise.
You should know about your body capacity. You should maintain that. Meditate. You should give a proper timing. Everything. It should started thing, because God has given us everything. We are blessed with many things. Then if you are not taking care of it, then I told you, Sharira is Shiride Anyanadi Sharira. The Sharira, once it is born, it has a tendency to deplete every day. Every day it is dying every day. So the Ayurveda and Panchakarma and Rasayana can be just delay the aging process. Like maybe you are at the age of 50, you may have some complication. But if you do regular Panchakarma and the experience area, everything, maybe it will show at 65 or 70. So 20 years you will live a healthy life. Because Ayurveda doesn't say that you live for 100 years, 110 years, it can delay the aging, it can delay the process of dying.
And also increase the quality
of life. Yeah.
Wonderful. I mean, that in itself is a beautiful boon of Ayurveda. But coming back to the 5 actions.
Yeah.
So if we just look at them individually a little bit, the first one you mentioned is Vamana. And Vamana is what really?
Vamana actually, I told Snehana, we have to select the patient. The Vamana patient selection is important because that patient should have good strength.
Yeah.
If the Madhyama Bala or at least above Madhyama Bala and good, it should have this because it is a process of getting vomiting.
Okay.
Boluses come. So if blood pressure should be normal. If a high blood pressure, we cannot do the Vamana. And it should be very healthy, means ready to get the treatment. So before that we have to do Snehapana, the Snehapana, Bahya Sneha, like a. Then we have to give some Madanaphala is the Madanaphala Kashaya. Like if after Snehapana, the next day we do one day we do Vishrama Dina. Vishrama means we do one Abhyanga, completely one Abhyanga, rest, and next day morning. He get more. That day before Vamana, evening we have to give him more sweet because kapha klesha. Yeah, because kapha, we are taking Vamana is for kapha.
Yes. So it's a medicated vomiting. It's basically a person eats like a lot of sweet.
Yeah, because we are in the sneha, we give the sneha to improve the kapha in the body, accumulate the kapha in the body. So the final stage we are taking the kapha out. So to take it easily, we force the body to take more sweet, like we aghanta pana till throat fill. You have to take milk.
Wow.
Milk in the evening time, and next day morning when at around 5 o'clock before the sun rise, we do one abhyanga and one svedana. Then we give one like a pasta kind of thing, like in your language like a pastry, like we make it with the jaggery and all. We make a sweet thing. We give the sweet thing, full bowl. Then we give Madanaphala Kashaya. Madanaphala is the key drug for Vamana. Vamana Kashaya. Then we tell the patient to put 2 fingers slightly in the tongue. Then suddenly they start vomiting. So we are this vomit. 1, 2. We have to see maybe 10 to 15. Up to 20 you can. So if he collapse a little bit, but we have to keep monitoring the blood pressure, how the blood pressure is going.
Wow! And what does this do? Like, what's the intention behind this?
It is just to take out the kapha out. If the kapha is more accumulated in the body, so with the massages and we accumulate the doshas. If you are interested, we can do vamana for you.
Yes.
Like for experience, because you are a suitable patient.
Okay.
We can do one day, but you should be very ready.
Okay. I'm a little bit positively nervous now.
That's why I have to see the strength of then I can say. So after the vomiting the procedure, we will give a dhumapana, like a medicated on the through the nose and mouth, just to clean the if any kapha is there. So is pittante vamana means we see the bolus first, it will come like a water or yellowish color, whitish color, greenish color. If kapha is more, come very thick. Finally it come yellow color. That means pitta is coming out.
So bile.
Yeah. If the pitta is coming out, we see that we have to stop it, because pittante vamana. If pitta is coming, means complete kapha is gone out. We are
stopping.
We are done. We have to do. Otherwise, if we are waiting more, then patient may collapse. So after that, we have to give the steam and all, and we give some gandusha and all. Then we make the patient to relax for the whole day. Evening, we give some rice soup, something to drink.
And just briefly, like what kind of diseases you treat with this?
Psoriasis mainly. If it's more in scalp psoriasis and upper part of the kaphasthana, if psoriasis more. In kushta condition, we can do. And obese person, if a very obese person, we can do. Where the kapha is more.
So but I told you diseases of this area of skin, because it also affects.
Yeah. Wherever kapha is more, we can do that.
Autoimmunity also.
Yes, you can do. But depend. I told no. I rarely select patients from European patients for vamana, because our sattva should be good. Because you see, when they vomit more and more, then they feel I am going to die, because
really
they feel like that. But it will be fine in the evening. But if the person is not that much inner strength, Saraga Acharya also said you should not give the treatment, because they feel that I am going to die, you are not going to kill me. Then they feel that. So it is not for everyone. Depends.
Okay, so this much about vamana. What is then the next one?
Virechana.
Virechana
Is for mainly for pitta condition, liver disorders, or any pitta is more same skin diseases or liver issues or any pitta related things we can do. Pitta vada also compare. In that also same massage will be there for we do snehabana. After that we do 3 days just only massage without any snehabana, like Vishramakala. We should have follow the diet and all. That will, we cannot explain everything. Then the morning just after sunrise we give a massage, Abhyanga and Swedana. Then we tell the patient to go for have the breakfast, light breakfast something. Then I give the medicine. Like we can give Trivitlegia or or Nembravastadi Erandam, or Nergundiadi Nimbamradi Eranda we can give.
So for the viewers, these medicines, they trigger purgation, right?
Purgation.
They trigger bowel movement downwards.
It will just stimulate the liver and just give a stimulation for the liver. Then the toxins are out. Then the body tend to push out the toxins from the body.
Wow.
So that accumulated toxins, whatever accumulated in the pitta, it will go away. So it's kaphante virechana. Like when you first it will go yellow color, then finally if it goes like whitish thick, then we have to stop, because kapha is coming from upper part. Then we have to stop.
I see.
And some frothy will be there, because vata we cannot see. There is no color for vata. No?
Yeah.
If some air and something is going there, it means that is kaphante vamana, the way virechana.
And I would say, from my understanding, then this, you said it's pitta, for pitta cleansing, right? So this is then for any inflammation in the body.
Inflammation, not only pitta vata.
Pitta vata.
So joint disorders we can do, arthrama vata, or anything we can do. Virechana.
And it cleanses, you said, liver, gallbladder, probably blood also.
Yes, especially for the pakshanga, the stroke or any. Because this is layer is covered by pitta, like avarana. The layers of brain are called pitta. So pitta.
Interesting. So okay, this is then virechana. What about the next one?
Next one is nasya.
Nasya. So nasya means nose.
Nasaya praniyamanam aushadam nasyam. Because whatever medicine we are giving through nose is called as nasya. Especially it is just for the kapha, mainly kapha. Because some sinus will be blocked here and some channels of eye, ear or brain. If something is clogged there, it helps to clean the channels. That's the purpose of the Nasya. And Urdu Jatra, whatever diseases with if you have issues with above the shoulder pain or stiffness here, frozen shoulder, all the things we can use Nasya. Nasya we can use with the oil, we just same way, Benga will be there, a good steam will be there, and insert the drops, either drops or powder or something to the nose. And after that, we will take it out and stick it out through the mouth. Take the oil inside the nose and take it inside the mouth and straight it out.
And
so
these are specific oils, right?
Specific oils. So there are Anutailam, Ksheerabala. Depend upon the disease we can set the oil. This is simply about the procedure.
And this is done, you said, for diseases above the head, right? So cervical spondylitis, any kind of arthritis,
sinusitis, and polyp, nasal polyp, or less eye vision,
eye problems, okay,
ear problems, tinnitus or something, any sensory issues of the upper part, and memory loss, and epilepsy.
So brain problems also, because
epilepsy patient, they collapse, then they have Brahma, they don't know the consciousness. If you give one powder to the nose, then they get up.
Like Vacha, right?
Vacha or something.
Very interesting. Okay, so this was then the third one. What about the fourth one?
Fourth one is Rekta Mokshana. Rekta Mokshana is bloodletting. Bloodletting means especially for the skin diseases and also. If it's skin, particularly if I am having a skin lesion here or particular here, I can put a leech here and tell the leech to leak the blood. So the lesion blood of that particular area, the leech will take out. Then that part is clear.
So it's kind of like local detoxifying.
Local, maybe varicose vein. We can give the blood. We can just cut that vein and take the bad blood out.
Wow.
Skin diseases and pain disorders we can do.
You see, this to me is very interesting. I don't know about Rakta Mokshana a lot, and also some viewers might say, "Wow, like how does this work?" So, what's the effect you see then afterwards? Practically.
Because first we have to take out the bad blood. When the bad blood is stagnant for long years, for months, when the blood is going, the patient feels immediate relief of the symptom. If the pain is there, due to varicose, the pain will go away. If itching, something is there in the skin, it will go away. And we are taking out the blood out, and we are giving some blood purification medicine inside. So that if it is not an immediate result, but slowly you feel the difference.
Wow. Very interesting. And then last
one is Vasti. Vasti is enema, especially for Vata. For whatever Vata disorder, if you have any, I told the Vata, main site of Vata is Pakwasya.
So this area below the belly button, large intestine.
Large intestine, the Pakwasya is the Vata side. From there, Vata go up, down, whatever functions it does. But if any issues for Vata, if any problem in the Vata, you have to treat the Pakwasya, Vata area first. So enema is the nearest route for Vata. The oil, because Vata is dry roksha. You are giving oil through the enema. The oil go inside and make the snehana there, and it nourishes that particular area, and immediately, especially if you have joint disorders or pain, backache, and if you give enema, it will go. Pain, suddenly you feel the difference. And it is miraculous result. You cannot say how does it happen. Immediately result.
Wow.
That is Vasti.
And so this is then used for diseases like
all the joint disorders, Sandhigata Vata or Ramavada or
rheumatoid arthritis,
osteoarthritis, like sciatica, all joint disorders, pain disorders, and infertility.
Infertility also.
For gastric irritation problem, we can do.
When you say infertility, you mean like low sperm count or erectile dysfunction
or premature ejaculation.
Okay.
All things we can do.
Wow. Okay.
Wherever Vata is acting more, to control the Vata, we can do Vasti. And for the viewers, I should say, many people know, some people, they read Panchakarma, they come to me and say, I need all this. It is not possible. It is not possible for any person to have. That's why we celebrate. Usually we practice here Nasya, Virechana and Vasti. Vamana rarely. It depends upon the patient situation we practice.
So these were the 5 treatments, right? And you mentioned the preparatory phase where you do Svedana and Snehana, which is oiling the body and steaming the body to open the channels. So, and then there are some other things you do, but we don't want to go too much into detail. and then you do these 5 karmas, right? And then there is the rejuvenation phase where you're stimulating the body back up, the digestion, right?
Because Samsadhyakrama is important. After any procedure of this, like Snehabana and Massage take 5, 6, 7 days, and then Virajana or Vamana 1 day main procedure. Then after the next 7 days is important to take the food and medicine properly, because digestion fire will be very low, because we are taking out all the dosha out. Then like Taruna Andavad, we can say, if it is an egg, fresh egg, like not formed correctly. If chicken egg, you know, if the egg is not formed correctly, it will be very thin. The outer part is not strong. So you should care the body like that. Once you
very fragile.
Once you just mistake, then it will burst. So it should be Taruna Andavad. It should be very fragile. It is very fragile, so it should be very taken care of.
So are people tired then after this second stage, and then you need to come?
Then 3-4 days after following the Samsadhyakrama, then you will. But then the third week is called as Rasayana. Depend upon the, maybe if the person is having skin disease, we go for some skin nourishing Rekta Prasadana Rasayanas, and some joint disorders, then we have to some joint spine care Rasayana, and for intellectual improval or for Vada disorder, we have to use some nervous tonic. So it is depend upon the completely.
Interesting. So Rasayana means rejuvenation. Right?
Rasayana is not only rejuvenation, it's like an immunity booster. But it's not only to take some medicine, it is to follow some diet and some activities.
So this is then the whole Panchakarma really explained. But one thing that I have also see is that within the frame of Panchakarma, you also use other Ayurvedic therapies. Is that correct?
Yeah, that I told about Panchakarma is the main karma. Pre-operative stage is there. Pre-operative stage. That in pre-operative stage we use different massages. Udvartana comes in because Rukshana. Udvartana is coming as a Rukshana to improve the appetite of Agni of the person.
So when we speak about massage, we're not speaking just about oil massage. We can speak about powder
massage. And Varuga said is like sand. We make a bolus and with each stamping. Steaming. And leaf, cutting the leaf and make a bolus form, and which is having anti-inflammatory action. We use that also.
So leaf pouches, hot leaf pouches.
So pouches, massages, powder massages, and oil bath, and water bath or buttermilk dhara. Everything is coming under, and especially the Shirodhara and some talam here, keeping some oil here, and some face massage.
I will post some photos of this.
Yes, that's why we are not giving the eye treatment or like a rejuvenation eye treatment or Shirodhara in the beginning. Some people come and ask me, I need Shirodhara, because they saw in the video or photo, this is the eye Panchakarma. It's a fire, it just comes in the last stage. After the cleansing is done, we have to do that. Yes. If I do in the beginning, they feel headache, because toxicity is there, then it aggravates the condition.
Interesting. So it's a very rich, for an Ayurvedic doctor, it's a very rich...
we have plenty of options to take care of. The thing is that the doctor should know the things, and the quality of the medicine, the technique, how to do, and that therapist should be very experienced in that, then we can do whatever procedures are required.
You see here a lot of different health issues. What are the most common ones?
Mainly Sandarpanajanya Vigara means overnutritious things like obesity and related complications. Obesity and its complications, liver disorders, lifestyle disorders is called. Diabetic and fatty liver and non-alcoholic liver disease and alcoholic cirrhosis patients, and pancreatic cyst patients and joint disorders like arthritis, rheumatoid arthritis, gouty arthritis, and osteoarthritis patients come, and frozen shoulder, cervical spondylosis, frozen shoulder, and intervertebral disc, IVDP, intervertebral disc prolapse or sciatica patients comes, and chronic sinus people, and polyp, and low vision like any macular degeneration or retinal issues come, and some tinnitus patients come. So usually they have all the symptoms. So, and some people come here very healthy. They say I am very healthy, just need some treatment. Then when I examine and we assess them, then it comes out everything. Then we correct it and we just manage it and just service it like a car. if you have your own car, you after some driving, you send them to the service station. The technician there look everything, each and everything, how the joints are there, lubrication, and how the engine, how the like liver, how the brain, how the ECV, like electronic commission. So what like a machine, you should check the body like a machine. Every part is working, or because every body part is connected to each other. These muscles are connected to this bone, so nervous system, and then this nervous is connected to the brain. So it's all connected. So we have to find where any electric charge is discharged, or if overcharged, or any muscles are
organs are stressed.
Like we check the air pressure, no? So, we have to see the muscle strength, how the muscle tone. So it is like that.
One thing that also I think might be very interesting to Western viewers, especially because we have Western medicine, right? And we do blood tests. I talked to you the other day and you mentioned that you also give them, your patients, opportunity to do blood tests.
Yes.
For diabetes, for cholesterol, for
as a general checkup, they can do we assess the liver, how the liver is functioning.
Yes.
How the kidney is functioning, how the lipid profile, like cholesterol, bad cholesterol, good cholesterol, how the ratio, how the thyroid is functioning, how the HbA1c, like your chances of getting diabetic in future, or how the iron in the body, like ferritin, iron and calcium, how the vitamin B, vitamin B12, and how the vitamin D and B2. So whole package. So we have a good center here. So they give us a discount price. So compared to Europe, you have a good chance to get the blood test here. Then after the analysis, I can give my view regarding what is the imbalance in the system, and clinically I can correlate and tell you.
Yes. So this then helps you to bring all the
together, yeah.
Like a really holistic picture.
Then the people know better.
Yeah.
Yeah.
What about, do you do this also afterwards to see the difference?
Yeah, some people, if the people are ready to stay for 21 days,
yeah,
first day they can take, and the last day also, because it's
like cholesterol, for example,
it is little expensive. So
so
usually I will not.
People are not playing with this too much.
Yeah, I will tell them to take in the, if they are staying for 21 days, I will take around 16th or 17th day.
Okay.
So then when I can feel the, then when they discharge summary, I will discuss with this and I give the diet and all this. Because I told Ayurveda is not a science, not blaming any other science.
Yeah.
Because Ayurveda says Satata Dhyana Vadaha Paratantra Avaloganam, means we have to discuss other science, and we have to practice that other science within our science.
And collaborate.
Collaborate,
right?
yeah.
Exactly.
We should take all the opportunities.
Exactly, because I always say that if you have, let's say, high cholesterol and you come to Panchakarma or just to an Ayurvedic doctor, and he gives you something, and then you see and you do blood test and you actually see the result, like cholesterol going down or any other parameters getting more balanced.
Sometimes for some people the cholesterol may get higher in the beginning, because we are bringing the toxins in the one form. Then after the cleansing it will come down.
Yes.
That's why I'm giving the blood test 17th or 18th day. Then only we can get the complete.
I see. Because there is some transformational process happening. Yeah, but what I was wanting to just say is that it's also good for people to see improvement in results from both angles, then long term, right? So now that's really wonderful. And last few questions: what is the usual duration of Panchakarma?
Usually, if a person is coming for the first time, 21 days.
21 days.
21 to 24, but 21 days is ideal. And if the person is repeating the treatment every year, then 2 weeks is okay. But if the person again missing the Panchakarma for 2 to 3 years, then he can come for 3 weeks again.
And here another question. So how many times would you recommend, or how often would you recommend?
Yearly once, but some cases like psoriasis or any stroke patients, difficulty to walk, if they can travel 6 months, once in 6 months.
So every half a year.
Half a year.
For like serious patients, patients with serious problems. And otherwise you say once a year, right?
Once a year.
Is there any post-care from Panchakarma onwards? Like when they finish
first to 3 months is important for them to follow the diet which I offer them. I will not tell, or we don't say it is a very strict diet. We just say the lifestyle adjustment, just follow that for next 3 months. Once they follow the 3 months, they feel the difference in the body. They might have follow for like another 6 months. So always for me, they are giving the good feedback that all they are feeling better.
Wonderful. So with this last question, we have concluded our topic of today's discussion, which was Panchakarma, and I think it was very interesting and very informative. I personally learned a lot, and especially the 5 karmas.
Yeah.
They were very, very, very interesting. And so thank you, Dr. Bhadran, for sharing all of this with us, for sharing all this knowledge about holistic healing. And thank you to all the viewers for being with us and for listening to this wonderful discussion. And inviting you to join us next week for the next episode. Thank you.
Thank you. Namaste.